Hi, my name is Lucian.
I am Rebecca.
And welcome to our presentation on demonstrating the fundamentals of virtual group exercise.
Welcome, everybody. So we are both trainers for the Steps to Wellness program at the University of Vermont Medical Center. And so a little bit about Steps to Wellness. It is a free 12-week group exercise program consisting of aerobic training, strength exercises, stretching, and balance exercises, and all designed to meet the unique needs of cancer survivors. So the main driving forces behind Steps to Wellness was really to provide survivors support to alleviate those late and lingering effects related to cancer treatments. So over the past 9 years, Steps to Wellness and this exercise interventions have shown solid evidence for improving muscular strength and endurance, cardiopulmonary fitness, balance, and a big one is fatigue. There's also some strong evidence with some additional evidence for improving sleep, cognition, anxiety and depression, bone health, and overall physical function. So with physical function, it's really our ability to complete activities required for safe and independent living. And key word is that independent living, right? Enjoying life, being able to do those activities that we want to do. So the exercises that we're about to bring you through and demonstrate are designed to help introduce and familiarize new participants with some of the program components seen throughout the 12-week program. So please participate at your own discretion and at your own risk. We encourage you to join in with us and have some fun. Here we go.
That's a big one. Have fun, whatever you're doing. All right, so the first thing we're gonna do is we're gonna just take a look at our space. Welcome to my humble abode. This little corner of my house that I've carved out for some exercise today. Big things we wanna be looking for is we have at least an arm's length between the left and the right side, and then the front and the back of us, so we can move around a little bit. Rebecca's got the nice twirl, the fan of white going on. You like that? The first thing we're gonna do after we do that is we're gonna work on our balance. So today we're gonna bring you through 4 different stages of balance that we work on in the Steps Wellness program. But I guess a more important piece here is why do we work on balance? Well, we need to ambulate, we need to get up, we need to walk, we need to move around. All that incorporates balance. A lot of other big things that come with that is as you go through your life, your balance will actually decrease over time naturally. That's just a fundamental piece of aging. Also, things like the different medications that you may have been on in the past or currently on, they can decrease your balance. You may have some current or some past peripheral neuropathy that can also affect the balance. The other big thing is as we get older, so as our balance decreases, our risk of falling increases. And we all know that we don't want to fall as we get older. As we become older, we most often become less strong, bones become a little more brittle, and we're more prone to injury. And that's the last thing we want as we age through life. So, Rebecca, you got anything to add to that?
No, let's get balanced. We got to unbalance ourselves to get balanced, right?
Yeah, there you go. Okay. Stage 1, balance. I just want you to bring your feet together nice and close. Okay, so pretend my hands are my feet. I'm just going to bring them close. When we balance, we want to make sure our weight is nice and distributed evenly. We want to have a small bend in those knees, and we want to make sure our belly and our butt is nice and engaged. We're going to stay here for about another 10 seconds. Sometimes putting our arms out like Rebecca is doing can help. It's not just picking a spot in front of you and lasering in those eyes and focusing on it can help as well. Good. You can open up those feet and give yourself a little break. From here, we're going to go what we call a semi-tandem stance. So I think my hands are my feet, they're coming together. I'm just gonna slide one of those feet about halfway back on my feet, okay? So I got my feet together. I'm just gonna slide one of those back. We'll put 20 seconds on the clock. I like to put my hands on the hips most of the time when we're balancing. But again, out here, picking a spot on the floor or the wall in front of you, and just lasering in and keeping that focus. Good. And you can step out of that. Now it's going to get a little bit harder. So when we go into these harder balance pieces, if that wasn't hard for you, It's probably gonna get a little harder. Want to have something like a chair or some type of stable surface close to you. As when we start to, so wobble a little bit, it usually starts from the ankles up and it comes on up. Want to have something that we can grab onto. Okay, so we went from that feet together, then we went to semi-tandem. Now we're gonna go all the way to a full tandem, or what we call heel to toe. So we're gonna bring those heels and those toes together, one foot directly in front of the other. Make sure you have your hand on that stable surface. I'm going to take that hand off in 3, 2, and 1. Here we go. 20 seconds on the clock. I don't know about you, Rebecca. I got a little bit of wobble going on in those ankles of mine. All you know is touch that down as needed in 2, 1, and step on out of it. There we go. Good. So depending on how where your balance is, that could have been a little hard, as you heard me say. I had a little bit of wobble in those ankles. Now we're going to go to the hardest. We're going to go to a single leg stance where one foot is actually elevated above off the floor. So we're going to start with our hand on our stable surface. We're going to take one foot up. Notice how Rebecca has her foot kickstanded back. You can always have that kickstand option where you're just barely touching that toe to the floor if you're not quite ready for that single leg stance. And we're going to take our hand off of that support structure in 3, 2, and 1. Here we go. If you're feeling those ankles start to wobble, really laser in on one spot and try to focus in. Make sure your core is nice and engaged. Make sure you have a good, healthy bend in that stabilizing leg. And rest. Good. All right. Yeah, maybe shake it out a little bit. I like your shimmy, Rebecca. All right. So now we're gonna make this a little bit harder, and we're gonna do one on each side. So take whichever stance was the hardest, but you were able to stay up without touching that stable surface the longest. So for instance, if my tandem was really good and say I got like halfway there, but when I got to my single leg stance, I was only able to keep my hand off for a couple of seconds at a time. We want to go back to that tandem stance. Okay. We're going to do 30 seconds on each one. And if you went through that single leg stance and it was super easy, you're like, yeah, we got this, no problem. I want you to add in maybe a little head turn to the left or to the right. And you look that head up and down. Okay. So hand on our stable surface. We're going to do one 30-second bout on each leg. Give yourself a moment to get nice and centered and into that stance. I'm going to start that clock in 3, 2, and 1. Here we go. 30 seconds.
I think I'm going to add some head turns.
Ooh, all right.
Pretty good.
We're about halfway there. Pay attention to what that belly and that butt is doing. Make sure you have a good bend in that knee. 30 seconds is up in 3, 2, and 1. Good. All right. I'm not going to try to keep up with Rebecca today. So if you had tandem stance, you're going to put that other foot in front. If you went single leg stance, you're going to elevate that opposite foot. Make sure you have a small bend in that knee. Sometimes called like that baby bend in the knee. We're going to take that hand off our stable surface in 3, 2, and 1. Here we go. 30 more seconds. Now you might know a slight difference from left to right or right to left. And that's pretty typical. Usually one dominant side or the other. And we're about halfway in there. So if you haven't touched down, maybe start to add those left and right turns of the up and down. And 3, 2, and 1. Rest. Good. Nice work. Okay. Maybe shake those legs out. Give your arms a little rest. And Rebecca's going to take over, and she's going to introduce some of the aerobic components that we work on.
So with those balance exercises, you just work through those 4 stances and finding, again, we want to be a little bit unbalanced, not so much that we have to hold on to that chair the whole time, but slightly unbalanced so that our body wants to get better so that it can balance a little more. So we got to challenge it a little bit. So you can practice those on your own as well. Some say when you're brushing your teeth, you could balance. When you're cooking, you could balance. When you're in line at the grocery store, you could try your balance, as long as it's safe. And again, you're having fun with it.
It's not advised to fall into the person in front of you in line. Trust me, I know.
No. So this aerobic piece that we created today was really inspired by autumn and fall. So first day of fall, it's looking pretty good so far. I'm excited to see all the leaves. We have the best foliage in Vermont. So I created this in spite of that. So I hope you enjoy our movements that we have. So general recommendations for cancer survivors is weekly activity, 30 to 60 minutes of moderate to vigorous intensity, at least 5 days a week, right? So we can start with 2. We can try to move to 3 to 4. We're just always trying to just find a reasonable goal to start with and then progress from there. You don't have to start 5 right off the bat. So we can take steps together as well. So the aerobic exercises consists of variety of body weight movements in all planes of motion. So you'll see all planes being demonstrated today. And then typically performed in intervals. So I'm going to do a slight interval training with these exercises today. So you'll hear a ding, knowing when to stop the exercise, and a ding, knowing when to start. And that just helps when I get talking to keep me on track with time. And then the intensity is increased as tolerated. So within the program over the 12 weeks, you are increasing yourself. We can also give suggestion when to increase as well. We can work together. And this is based on individual fitness and level and musculoskeletal limitations as well. So those that are currently receiving chemotherapy may exercise at a lower intensity to start, but again, always increasing as tolerated. So this program really can be for any level of fitness. It can be modified. So here is our autumn fall inspired exercise. So Lucian's going to demonstrate some of the seated modifications. So again, this can work for any level of fitness. I'm going to do some standing modifications and progressions, and you just try to work wherever feels comfortable to you. Okay. So we are going to try to get your heart rate up a little bit. This is the noon hour, right? So we're getting to move about from out of our chairs if you'd like, or just getting the blood flowing. So I use an app on my phone to help me keep time. So I'm going to use that. So the first exercise that we're going to do is we're going to go pick some apples. I hear a lot of apple trees were full this year. So we're going to go pick those apples. All right.
If it starts to get hard, just think about the apple pie you'll have later. It works, trust me.
I tried to make that into an activity and it just wasn't working. So I went with apple picking, the first step for an apple pie. All right. So we're going to start in 10 seconds. And we're going to go apple picking. So you're going to think of using your opposite hand, opposite leg. And there's the bell. So I'm going to reach for the apple and pull it down from the tree. Reach for the apple, pull it down from the tree. So we can start. This is the first time you may be seeing this using your opposites. So left and right. So there's a little bit of thinking there involved to start. And we're reaching and coming down. We're keeping the chest up nice and high. And we're really reaching that hand up overhead as we're lifting that leg up. 3, 2, and 1. All right, now we're gonna go on a nice fall hike, whether it's phyllo, camel's hump, Indian brook. So we're gonna go up and over the tree limb. You can use your chair. We're gonna come up and over. We're climbing up and coming over that tree. We got big logs coming up and over, getting back onto the trail. So here I'm being really mindful to keep my chest up. I'm pulling in my core muscles, landing softly, and then pushing off to get that leg up. So a little bit of balance is included here. 5 seconds, 4, 3, 2, and 1, right? And then we're gonna go pick some pumpkins to make some jack-o'-lanterns. So these aren't pie pumpkins. These are big pumpkins. We're going to spread our legs. So we're going to push our hips back, grab that big pumpkin, and we're going to put it in the wheelbarrow that for some reason I put a little too far away. Let's pick up the big pumpkin and put it away. So when I'm coming down, you want to think of pushing the hips back. My back is staying flat. I lift up using my glute muscles and putting it down. Good. Excellent. 3, 2, and 1. And then the last one, we're going to get into a march. So you want to try to keep this pace, and we're going to go through a corn maze. I'm going to say numbers on a clock. It'll start to make sense. So if I say 12 o'clock, you go forward towards 12 and then come back to the center of your clock. If I say 3 o'clock, you go over to 3 o'clock and then you come back to center. 2 o'clock, you go out to 2 and then back to center. 9 o'clock and back to center. 12 and back to center. Great job. 10, little diagonal step back to center. 3 and back to center. Nice job. We'll pick that one up again next round. All right, we're going to go back to apple picking. So get your opposites ready. We're going to start on the right side. Okay, we're going to reach to the right and then go ahead and put that apple down into your bag. Reach to the right, put that apple down into your bag. Good. So we're just adding a diagonal movement, right? Putting those apples in the bag, reaching up nice and high for those apples. And we're just adding a little bit extra movement here. Now, again, you can always modify. You don't have to add this added part. And stop. All right. So on this fall hike, there's a stream, a river. We're going to hop over the river and then come back over. So we're working on forward motion over the river and back. Being nice and soft with the knees, stepping nice and light on the toes, up and over the river and back. And notice which foot you're leading with. Go ahead and try to switch which foot you're leading with. It's a little more mind control here to lead with your non-dominant side. 3, 2, and 1. And coming back. Awesome. We need more pumpkins. The wheelbarrow is now on this other side. So feet are wide, nice and supported through the core. Pick up that big pumpkin and put it onto the other side. Great. So hopefully you're noticing your temperature is rising, right? I'm getting some heat going in the body. My blood is flowing. Oxygen is going to the working muscles. Good. We're working at a higher intensity here, hopefully into that moderate zone. I'm having to take some breaths in between my sentences. And stop. Okay. We're going to that corn maze. So we have 9 o'clock, 12 o'clock, 3 o'clock. Let's get into your march. I'm going to go into a jog. Let's go to 1 o'clock. You go up and come back. 2 o'clock. Good. 9 o'clock. 12 o'clock. Keep up, Lucian.
I'm trying. I'm sorry. It's hot in here.
10 o'clock. 12 o'clock. 1 o'clock. 9 o'clock. It's harder for him if I'm calling them out. 3, 2, and 1. I already know.
AKA she's cheating.
All right, we've got one more time through here. We're going to pick some apples. We're going to the other side, left side, reaching down into the bag. So opposites. Here we go. I got to think. Reaching up, putting it into the bag. So your apples are up nice and high. Maybe some are a little to the side. Maybe one's right behind. I want to get this one right behind and put it into the bag. Good. So again, all these can be modified. You can take breaks anytime you need during the program. Grab some water. You can always modify. And stop. All right. Now we're going to go on a fall hike. This time we're going to go up and over the log. We're going to jump the river and then up and over the log again. So we're going to make a little box. We're just combining these two. So up and over. Good. Over the river. Up and over the log. and then back over the river. In the spring, it's a lot bigger of a river than in the fall. So we'll get better by the spring. Here we go, up and over. Nice job. 3, 2, and 1. All right, pumpkin picking. Maybe I lift one and throw it towards you. Maybe you step out to grab that pumpkin and then put it in the box. So I'm going to add a little step and then putting it into the box. You do not have to add the step. You could always just stay right here working on that, almost essentially the squat, and picking up your pumpkins. Good, working on that core strength. If you want a little added progression, you just add those steps. Excellent. 4, 3, 2, and 1. All right, going through the corn maze one more time. Pick your pace, either a march. I'm going to go into a jog. 3, 2, and 1. Let's go to 12 o'clock. Let's come forward and come back. 1 o'clock and come back. 1 o'clock. Ooh. And back. 3 o'clock and back. 10 o'clock and back. 11 and back. 9, 1, 3. I'm getting faster. 2 and 10. And stop. Let's all go into a nice light march. Work on some recovery breaths. Nice job. That was a full 8 minutes of aerobic exercise, and also mixed in with some different planes of motion, some different functional motion, right? As we get our heart rate up and hopefully had some fun thinking of those fall activities we're gonna go do. Lucian always loves apple pies, so if you got extra apples, hopefully our
trying to keep up.
Hopefully our contact information is somewhere in here as well. So let's just cool ourselves down, a few deep breaths. We never want to just stop exercising or just moving, because we want to bring our heart rates down nice and naturally. So I'm taking nice deep breaths into the nose. Exhaling out through the mouth. Right, and if you found this difficult, then I say great. There's different modifications that we could take. It gives you a great idea of some different movements that we'll go throughout the program, and offer more modifications as well. Or maybe you try it seated next time. And if you found you could have done more, that's also great. There's some also additional modifications, or maybe you start with those third round exercises a little bit earlier. So just to demonstrate some different progressions that we could do. Great job. Grab some water if you have some by you. If not, get some water.
Get some water. You see me drink water twice now.
I'll do the same.
It's super important to stay hydrated. As you guys do that, we're going to transition into our strength training. So far we've gone through some of the balance stuff that we do, and we've gone through a very, very small portion of the aerobic stuff that we do. In this virtual program, there is a lot of different movements we can do with our body. And so Rebecca was gracious enough to just pluck out a small bit. So there's lots more. But we're going to transition to strength training. We picked out a few lower body exercises and a few upper body exercises for you. We're going to start off with the lower body. And the first one is arguably the most functional exercise we do in the program. It's called our sit to stand or our squat. Now, the big difference between the sit to stand and squat, one starts at the bottom, one starts at the top. You're going to want to make sure you have a chair here. Since I couldn't keep up with Rebecca earlier, she's going to demonstrate the squat for me today. So there's a couple of basic principles we want to be thinking about here. I'm going to adjust this down. I'll get over by my chair. When you start from the bottom and the top, or from the bottom, you want to make sure you have a good seat underneath you. From the top, you want to make sure you're close enough to the chair so you have support here. And if we talk about our foot positioning, we want our feet to be positioned underneath our shoulders, relatively underneath our shoulders, And our toes are going to either point forward or slightly out. And that's going to change depending on your hip mobility, your ankle mobility, and your capacity to get up and down. So there are distinct advantages of bringing your feet a little bit closer or a little bit wider, depending on who you are, how tall you are, how big your chair is, and so on and so forth. So generally about shoulder width apart, toes forward, and then slightly out. When we talk about our breath work, we're going to be breathing in as we lower. We're breathing exhaling as we rise. And we're all going to start nice and tall with our chest up, our belly engaged, our glutes fire. I mean, I want to squeeze those butt cheeks. And if you can, put those arms across the chest. We're going to do 8 repetitions of each exercise today. And this will be the first one. So take a moment, make a choice whether you want to start standing or seated. And we'll start in just a few seconds. So I'm going to check in with my feet, make sure my ankles aren't too close to my chair. Check and make sure my toes are in the right position, my feet are in the right position. I'm gonna get nice and tall. I'm gonna gauge my belly, pull my shoulders back, make sure my butt cheeks are firing. Hands are here. And now from the seat, I'm just gonna lean forward slightly. I'm gonna load my hips and my quads and my heels. I'm gonna take a breath in, and I'm gonna take a big breath out, stand up, squeeze the butt, come up tall. Rebecca's gonna inhale as she lowers. And then when she gets nice and low, she's gonna push her feet into the floor and raise up. That is a picture perfect squat, folks. So we'll call that repetition number 1. And now let's repeat for 7 more. So if you started from the bottom, you're standing up nice and tall like me. You want to get back down. We're going to inhale, push the butt back, come down to the chair. Just tap it. Excuse me, just tap it if you can. And then push those feet in the floor, squeeze the butt, rise. There's 2. Inhale, lower. Exhale, rise. 3. Notice how my chest is staying up, my belly staying nice and tight. There's our 4. And we're going straight down for the most part and straight back up. 5. If you have to give yourself a little bit more of a rest on the chair, that is okay. 6. Last 2. 7. Notice how I can create just a little bit momentum right here. And 8. Good. And shake out those arms and legs. Give yourself a little bit of a break. There's a couple things you can do to modify. If it was too hard from where your seat is, you can always elevate your seat. You can put like a pillow or some type of cushion up here to help you get up a little bit higher. Generally, when we start, we want the hips in line with the knees. If the knees get higher than the hips, it's a lot of pressure here. So I want to make sure we're at least here. And if it's too hard, we want to start with that seat up just a little bit higher. All right. Now so that was our bilateral lower extremity movement, meaning both sides. We're going to do a single leg movement, which is our split stance lunge, or we call it split lunge. We sometimes heard it called it as a split squat. Essentially, I'm going to stand behind my chair with my chair next to me. I'm going to take a big step forward. If you feel more comfortable, you can always take a big step backwards. But the big principle here is that my feet are nice and wide. And then if you look at my back foot, my back heel is up and both my toes are forward. And you notice I transitioned my chair in front of me. Personally, that's a little more comfortable. Rebecca likes that as well. But if it's more comfortable for you to have that chair next to you, you can always have it there. Most of us have been to some type of fair or carnival. We've seen carousels where you have the pole and the horse and it goes straight up and straight down. That's what I want you to think about as you go through these. This is a harder exercise, and Rebecca is going to demonstrate what we call just a step back, right? So this is practicing it, so stepping back and gradually just bending that knee. So if you're not totally comfortable going all the way down, you can start with the step back, so tap back, a little lower, and then back here. If you want to try it and you're comfortable with it, we're going to get nice and wide here. You're going to get that back heel up off the floor to start. I want you to squeeze that back butt cheek. Hands are on the chair, either in front of us or next to us. And we're going to lower down. We're going to breathe in as we lower in 3, 2, and step back, and 1. Here we go. Go down to your level of comfort and push into that front heel and come right back up. Notice how my chest stays upright. I'm keeping my belly engaged. I'm pushing into that front heel to stand up nice and tall. And Rebecca's doing a great job in that step back. And there's our 5, 6, 7, and last one. And big push, and 8, good, and step forward. Now, you notice that I stayed in one stance. When you stay in that single stance, the front leg is doing most of the work. You guys noticed that Rebecca was alternating sides. We're not gonna do both sides in that split stance. If you wanna take a moment while I'm demonstrating to do your other side, feel free. And for time's sake, we're not gonna go to it. So again, if you're gonna step back, you can always have that alternating lunge here, boom. But when you stay static here, you're gonna do all repetitions on one side and then set up and do all repetitions on the other. Last one, we're gonna work on what we sometimes call, affectionately call the side hips, or what more appropriately called an hip abduction. So we're moving away from the midline of the body. And Rebecca's gonna show the seated version. I'm gonna show the standing version. So for the seated version, we're gonna sit up nice and tall on that seat. Both toes are gonna be facing forward. We're gonna elevate one of those feet from the floor. You're gonna squeeze the side of your hip and open it up. Nice, and a nice easy release back. Good, so all that squeeze comes from right here. If you're standing, feet underneath the hips and toes forward. Remember, we talked about that baby bend in the knees. We're gonna stay up nice and tall, and we're gonna move that foot away from the side of the body. Now look at that toe, it's not pointing out here. I want you to think about pointing your toes towards me the entire time, okay? So find those ready positions, whether it's seated or standing. We're gonna all take a big breath in together, and when you're ready, exhale, open that foot away from the body. Staying nice and tall, stay up nice and tall, and right back down. Good, and here's our 3. And 4. Give yourself a little check-in. Maybe you look down at that toe. 5. Sometimes it likes to play a game on us and point out to the side, even though we think we're pointing it forward. And 6. 7. Last one. And 8. Good. So I was moving my right hip and I was standing. I can also feel a little fatigue on that left side. These abductors, they help stabilize the body and that lateral movement. So really important to have good hip control and stability. So even though I was primarily working this side was doing a lot of that work for me and helping keep me upright. Rebecca, what do you think? Do you want to even it out? Or you want to move on?
Ooh, I think I want to move on.
All right, let's move on. So we're going to move on to the upper body. The first one is what we call an overhead press, and it's working on our shoulders. Just a quick adjustment here. This one can be done seated or standing. The movement actually doesn't change any at all. It's just really what you're comfortable with. If you have weights when you bring weight up to your shoulders, I want you to keep the weight nice and close to your body when you bring it up, and keep that belly nice and tight. We don't want that back arching, and the farther out we get, the more stress on the lower back it puts. So we're going to squeeze the belly, bring those weights up to our shoulders. And if you can, you're gonna open those palms up, face forward. Notice how my elbows are right next to in line with my armpit and the side of my body. So belly and butt tight from this position here. We're all gonna take a big breath in, then exhale, we're gonna push those hands up to the ceiling, big reach. Inhale, lower right down to that goalpost. Belly and butt tight, exhale, reach. Inhale, lower. Good. Now you might feel your shoulders shrugging up to your ears right now. I want you to do your best to pull those shoulders down and not let them do that, even though they really want to as you press up. Good. 4 down, 4 to go. Big breath out. 5, 6. If you have some tightness in your chest, you can always bring those elbows forward a little bit. 7. And last one. And 8. Now, same principles apply. Keep the weight nice and close as you bring it down. Good. Maybe shake those arms out a little bit. If you're really intentional, you don't even need weight sometimes. You can really feel it in those shoulders. This last one, we're going to work on our back muscles. It's called the bent over row. This can be done from the seated or the standing position again. We'll talk about the seated version first. Rebecca, notice how Rebecca's moved forward in her chair a little bit. So that way her hands, as they're down by her side, have a little bit of clearance. Now this next part doesn't change whether you're standing or seated. You're gonna get nice and tall, and you're gonna tuck that belly, and you're gonna squeeze that butt. When you bring that chest forward, you're gonna keep that back nice and flat. Rebecca's floating forward until until her shoulders are just about in line with her heels and her knees. And from the standing position, I'm going to bring my feet in a little bit close. My hands are down by my side. Notice both of us have our palms facing in towards our side here. I have that small bend in my knees. I'm pushing my hips back until my hands come just over my toes. Now, we're both going to pull in here. Think about pulling your elbows behind you. Work these muscles in here. Keep these muscles nice and tight, and keep the hands nice and close to the body. Don't let the elbows flare out like this. All right. So we're all in that ready position. Shoulders are squeezed together. Belly is tight. Butt is tight. Let's all take a breath in. Then big breath out. Big pull. Inhale, lower. Exhale, pull. Squeeze those shoulder blades together when you come up. 3, 4, nice work. 5, good. Way to keep those elbows nice and close. And 6, last 2, 7, keep that belly nice and tight. And 8, good. And stand up nice and slow. And if you have weights, you can put them down. Maybe shake out that belly, shake out the arms and legs. And that is it for our brief strength training introduction today. Some of the stuff that we do here at Steps to Wellness. Those are definitely some of our more fundamental exercises. Talk about all super functional. And we got lots more in our toolbox.
Okay. So let's stretch it out. A piece that is often missed, but just so rewarding and so important to do, right? So strengthening, we're contracting the muscles, shortening, trying to build them up. And then the stretching just helps to elongate them again, encourage flexibility. Okay, so I'm gonna have a seat. I love to stretch sitting down to rest my bones so that I can relax to really stretch out those isolated muscle groups that we're about to do. So
my favorite.
Nice deep breath out. And we're going to start with the shoulders. We just worked the shoulders. So we're sitting, but I'm just going to stand just so you can see me a little bit better. So I'm going to take my right arm. I'm going to bring it across. You're going to give yourself a nice pat on the back. Okay. And then I'm going to take my left hand and just kind of grab my elbow, loosening up the right, and then just bringing it across the chest just a little bit more. And hopefully you're getting a good stretch in the shoulder. And with stretching, we want to breathe. Our breathing encourages relaxation.
Hypoxia is not good for anybody.
No. Good. Good. One more breath in and out. And we can release. Let's open up before we transition, stretch out the chest. And then I'll bring my left arm across the right. Few good pats, right? Some self-appreciation. The right arm comes underneath the elbow and then just helps that arm across the body, reaching a little bit maybe farther down my back. So I'm going to watch my shoulder and kind of bring that back down a little bit. And then we're going to breathe. So I feel some tightness here. That's where the stretch is mostly happening. So I'm just going to breathe into that area, kind of that mind-body connection, just to relax. Good. One more deep breath in. And then we can open our arms back up. Nice big stretch out, reaching the arms back, kind of opening up the chest. Go ahead and wiggle the fingers. And then push them back. And feeling a stretch in the wrists.
Titanic stretch.
And you can lower the hands down, maybe feel a little different stretch in a little different position. And then we can bring them all the way down and behind. I'm going to clasp my hands. And maybe if you are seated, maybe you're grabbing the back of the chair if you can't quite get your hands together. And all we're trying to do is just open up the shoulders a little bit more. So seeing how that range of motion, noticing. Okay, we're just noticing what our range of motion is, our flexibility is here. That's all, no judgment. And breathe. Good. We can unclasp the hands, bringing them back forward. A few shoulder rolls forward. Just moving the shoulder blades. And let's switch directions. And we'll move to the side of the body. I'm just gonna widen up my stance just a little bit. I'm gonna bring my left elbow onto my left knee, just putting some weight into the left side. And then just trying to feel the stretch in the side of the body. Maybe this is enough. Maybe I bring my hand onto my hip, opening up the chest just a little bit. And if you feel like a little bit more, you can start to raise that arm up overhead. And then even a little bit more, that arm might be coming across bicep towards the ear. So anywhere in between there, just feeling a side stretch. Good, let's roll forward, both elbows on the knees and just kind of loosening up the lower back, getting some movement in the spine. And then I'm gonna bring my weight over to my right side for that same stretch. So right arm, elbow onto the right knee. Just starting here, kind of stretching out all the way through the hip. Maybe your hand comes onto the hip, opening up the chest just a little bit. You can look up if your neck allows. And then again, that arm option to come up. And just stopping at that point where you feel a good stretch, not to go into pain. Good. And deep breath, breathing into the side of the body. And a big exhale forward. You can go ahead and just kind of let your arms go and just kind of let yourself hang just a little bit, just maybe moving slightly side to side, just trying to loosen up that lower back. We'll walk our hands up our legs as we rise, nice and slow. No rush. Good. I'm going to bring my legs back in. We're going to work on the lower body. So I'm going to bring one leg out straight. Scoot back just so you can see my foot. And then the toe, I'm going to pretend like I'm pulling that toe up towards me. And that should start to get a calf stretch right in here into that straight leg. So actively trying to straighten out the leg. This leg is being supportive. Then I'm going to sit up nice and tall. Good. So moving from the calf stretch, we're adding into the hamstrings as well. You might feel the hamstrings right now. If you want a little bit more, we're going to make sure we're up nice and tall. And we're just going to tip ourselves forward, keeping that straight back. Almost pushing the hips back, reaching out through the heel and seeing if that toe can stay up. Good. So that sensation should come all the way up through the back of the leg into those hamstrings. And you might not have to tip forward very far. These hamstrings get pretty tight. Good, so not painful, just a nice stretch, encouraging that lengthening. Go ahead and inhale and rise out of that. We'll bring that leg in and we'll bring the other leg out to even this up. So I'm going to bring that toe up, trying to actively push my heel out. And breathe right here for a few breaths. Good. Next inhale, I'm going to lift up nice and tall to the spine. And I'm going to exhale and tip forward to add that added stretch into the hamstrings.
Rebecca, you didn't tell me my left side was going to be tighter than my right side.
You didn't know our sides are not created equally.
Oh, well, now that I know, thank you.
And let's inhale up and out. Good. Then I'm just going to bring an inner thigh stretch into the game here by bringing one leg out to the side. And that should start to stretch out the inner thigh here. So my toe is up. Some people prefer their toe slightly forward. This is more comfortable for me. So I'm just going to have my toe up and I can feel that stretch pretty well throughout the inner thigh here. Gently bring that leg into center. I'm going to scoot to the other side and just bring that leg out. So areas that we use these with were maybe those stepping up and over the log, right? Up and over the river, those picking up the pumpkin side to side with those side steps. That was all including this inner thigh muscle. But in general, a full body stretch is always appreciated by the body. Anytime, every day you could stretch. Good, let's bring that leg back in. I'm going to scoot all the way back into my chair. Back is supported. I'm going to go ahead and float the legs up and just kind of relieving the weight from the feet. I'm just going to point and flex, bringing those toes back up. So I'm just going to move through that motion a couple times, just creating this pumping motion, circulating the blood flow here. And we can circle the ankles around, feel those little pops and cracks, and that's normal.
Call those Rice Krispies every once in a while.
Yeah. And lowering those down. We're going to do the same pumping motion by just bringing the palms up above the heart and squeezing and then releasing. So just constricting and then opening up. Good. You still got your breath. One more. Good. We'll bring the arms all the way down. We'll end with 3 deep breaths. Let's lift up. And all the way down. Good. Again. You could look up towards the ceiling. Filling the body up with oxygen. All the way down. Good. Let's look over to the right. And through center to the left. And through center, let's bring the right ear to the right shoulder. And the other side. Feeling the stretch right through the side of the neck. And then back to center, and then just taking a moment to just kind of scanning through the body all the way from the crown of the head to the toes and back all the way up to the crown of the head. And just appreciating the work that you did if you tried these out. Awesome job, everybody. Hopefully you enjoyed some of the fundamentals of the Steps to Wellness program, or just general movement to keep ourselves moving forward. So.
Yep. Thank you, everybody. Take care. Don't fall asleep. You got more stuff to see.
Take care.